Time now for Morning Rounds with CBS News contributor Dr. Tara Narula and Frances Largeman-Roth, registered dietitian and nutritionist and author of Eating in Color. First up, prostate cancer. This week, actor Ben Stiller spoke publicly for the first time about his June 2014 prostate cancer diagnosis. Stiller, who was 48 at the time, had surgery and was deemed cancer-free 3 months later in September.
At first, I didn't know what was going to happen, so
Right.
I was scared. I was scared. I didn't know. The one thing that it does is it just stops everything in your life when you get a diagnosis of cancer, because you can't plan for a movie. You can't because you don't know what's going to happen.
Stiller later posted an essay on the website Medium detailing the diagnosis and the aftermath. Tara, obviously that's put a big spotlight on prostate cancer right now. How common is it exactly?
That's right, and it's so brave of Ben Stiller and many of these celebrities to come out and talk about their diseases publicly. This is a disease that affects 1 in 7 men. It's estimated that this year there'll be about 180,000 new cases of prostate cancer in men in this country, 26,000 deaths. This is the second leading killer in terms of cancers for men after lung cancer, and the second most common cancer in men after non-melanoma skin cancer. It's typically a disease of older men. The average age of diagnosis is around 65, and relatively uncommon if you're less than 40.
And Tara, I know that Ben Stiller said that the PSA test saved his life, literally. That was the quote. But I was surprised to read that it's been a little controversial at times as well. What exactly is it?
That's right. So it is a blood test. It is a screening test that hopes to pick up cancer before there's symptoms and when it's early enough that we can treat it appropriately. It is a blood test that looks at levels of protein secreted or produced by the prostate cancers, by the prostate cells. And this PSA level, there's no real normal level in terms of abnormal or normal. There's no cutoff. But if the level is greater than 4, it's suggested that may be more concerning for cancer. If it's greater than 10, about 50% of men will have a cancer diagnosis. Now, the reason it's controversial, there can be false negatives. So you can have a PSA that's less than 4 and still 15% of the time have cancer. If you take medicines like Proscar or Propecia, that can falsely lower your level. It can be falsely positive for if you have BPH or prostatitis. The biggest reason it's controversial, however, is that many times we pick up small cancers that would never become clinically significant. They would never go on to kill a man, but yet they do go on to cause biopsies, which can result in infection or bleeding, or even procedures like surgeries or radiation that can cause incontinence, impotence, and bowel problems.
Right. I know I had one of those false positives, scared the heck out of me.
Exactly.
So you have to, I went back and had another one. It was a much lower number and was fine. But you've got to be aware that sometimes those numbers are wrong. So what are the current recommendations for testing?
So the biggest recommendation by all the societies is that this should be an informed decision, meaning that men should sit down with their doctor and have a discussion about the risks and benefits. It is recommended by the American Cancer Society that discussion start at age 50 for most men of average risk who have a life expectancy of over 10 years. At age 45, if they are at high risk, meaning they're African American or have a father, a son, or a brother who's been diagnosed early with prostate cancer. And if they're at the highest risk, meaning they have more than one family member who's been diagnosed early, then that discussion should happen at age 40.
And Frances, I know there's no way to prevent this, but are there ways with diet and exercise that you can try to reduce your risk?
Sure. Well, you're right. There is no anti-cancer diet for any specific cancer, but studies do show that by eating 2.5 cups of produce each day, so fruits and veggies, we know that people are not getting enough of this. That is one way to reduce your risk. And then specifically, there are foods like walnuts that do show promise with prostate cancer. And then also getting regular exercise. We're talking about daily and staying at a healthy weight. And of course, the regular exercise and those 2.5 cups of produce are going to help you stay at a healthy weight.
Things that we hear all the time just for normal health as well. We move on now to that dreaded holiday weight gain. This is not my fault. Thanksgiving is fast approaching, and research that was published in the New England Journal of Medicine shows that we may, in fact, gain pounds along with the gifts that we get during the holiday season. The study examined people in the United States, Germany, and Japan. Americans and Germans gained the most during the Christmas and New Year period, while the Japanese put on weight during Golden Week, which is a major Japanese holiday. Frances, obviously people are not going to give up their favorite foods. No. But if they indulge, and when we indulge, because we will, what should we keep in mind?
Okay, first of all, stick with mom's apple pie if that is what you love, and forget Aunt Millie's sweet potato casserole. cholesterol, just all the stuff that you don't really care about, leave it. Just leave it to the side, and then always use a plate, because we've all been guilty of standing by the buffet table
In the
and just
fridge.
nibbling, just
Inhaling
nibbling,
is a better word for what I do, yeah.
all of it. So if you use a plate, at least you have a visual cue, and that's going to help you remember, oh yeah, I already actually had a whole plate of food. And then
Or two.
yeah, and then finally, the booze. The booze calories, they just add up, 125 calories for a glass of wine, and that's a 5-ounce glass of wine. 135 calories for a 12-ounce beer, and then 200 calories or more for a cocktail. So use the 1-to-1 ratio, which is 1 alcoholic drink per hour, and then always follow it up with a glass of water.
Yeah, and Tara, obviously there are maybe some different foods as a cardiologist that we should keep in mind to have instead during the holiday season.
Well, there's things that we worry about as a cardiologist, and salt is one of those things. It's sneaky, and it hides in places like poultry and breads, which we consume a lot of. The average American consumes about 3,400 milligrams a day. The recommendation by the American Heart Association, 1,500 milligrams. For reference, 1 teaspoon is about 2,300 milligrams. So you need to read the label. You need to rinse off canned beans and vegetables and use herbs and spices when you're cooking at the holidays instead of salt. Your meat, you should consume the leanest cuts of meat, about 3 ounces, which is the size of a deck of cards. Avoid trans fats and partially hydrogenated oils in a lot of cookies and pastries, and added sugars in holiday beverages. And most importantly, remain active.
Yeah.
So just because it's the holidays doesn't mean you can't get out and exercise.
Dr. Tara Narula, Frances Largeman-Roth, thank you both for being here.